Good morning, good afternoon, good evening, everyone. You're welcome to today's episode of Public Health in Real Life, a channel where we highlight key global health issues, celebrate unsung heroes from the field, and inspire the next generation of global public health practitioners. We're in the middle of a paradigm shift in the health commodity supply chain field. Supply chains globally are adopting and adapting to best practices in tracking and tracing of health commodities and leveraging cutting edge technologies to optimize supply chain management. As high income countries move on to embracing sophisticated artificial intelligence and blockchain integrated innovations, low and middle income countries are also taking baby steps in their own ways to keep up with the increasing international standards. This really depends on what the supply chain commodity calls the maturity level of a country, different from one country to another. Today, we are honored to have Edward Wilson for a conversation on implementing sustainable and interoperable global health supply chain systems, where we will dive into the lessons learned along the way that countries can learn from as they improve their supply chains by integrating the latest technologies. Over to you, Ashwin, to introduce our guest for today.
Thank you so much, Maimuna. We are definitely honored to have Edward Wilson today. Let us bring him on the stream. Just a moment. Edward is the current director of the Center for Health Logistics at John Snow Inc., JSI, and he's the director of Partnership for Supply Chain Management, which is a John Snow Incorporated affiliate. Edward has over 30 years of experience in pharmaceutical supply chain management. And speaking about Edward, the names people say are he's a leader, an innovator, but most importantly, he's a supply chain thinker. There is no institution that Edward hasn't worked with, the governments, NGOs, bilateral and multilateral donors, and academic institutions with a single focus to improve access to medicines and medical supplies globally. As the director of the Partnership for Supply Chain Management, Edward oversees a supply chain services organization that sourced, procured, and delivered over $300 million worth of health commodities to 86 countries for a range of public, private, and nonprofit clients in 2020. Edward's current interests include driving continuous improvement through improved data visibility and use, building partnerships at national level to drive supply chain transformation, and helping national governments move from operating public health supply chains to being stewards of public's access to medicines. Uh, Edward, welcome to the program.
Thanks very much. It's a pleasure to be here. Thank you for the opportunity. Look forward to the conversation today.
Thank you. So to just start us off, if we look at the procurement and supply chain management history, we can divide it really into three sections or three parts. We have this era when there was no data captured to paper-based data captured, and now we are going through this paradigm shift where data is captured digitally. If you can just start us off with a basic introduction of why sustainable and interoperable systems for supply chain are essential, and what kind of systems must countries invest in to avert drug shortages or increase the availability of medicines.
Yeah, thanks very much. So I think just to start with, in terms of why they're essential, in the supply chain world, we talk about information being the lifeblood of any supply chain, and that without information, you really can't manage a supply chain effectively. And the more up-to-date information you have, the less friction you're going to have in your supply chain, and the quicker you can make products available to people that need them where and when they need them. So really, as we think about supply chains, products flow down a supply chain to an ultimate consumer, and information flows up a supply chain to inform all of the actors in the supply chain in their planning and execution activities. So without information, you really can't operate a supply chain. And anytime there's any latency in information, that just means that there's likely to be um, hiccups in the supply chain, and it makes planning and executing more difficult.
Sure.
So just to build a little bit on the question you asked about where are we now and kind of what's next, um, I would say we've made pretty good progress on improving systems and processes and capabilities at the global and national level. Not to say that everything's perfect and there isn't more to do, but the remaining challenge is really the middle and last kilometer or meter in the supply chain. Until we're collecting demand data at the point of handover to a patient or service provider or customer, and until we can make those data visible throughout the supply chain, our ability to improve availability will remain limited, and we're going to have to plan and execute based on sort of old information or aggregate information, which is just imperfect at best.
Sure. And when we speak about technological improvements, one aspect that is usually ignored is about the National Drug Regulatory Authority body, and what diplomatic roles can agencies like USAID, AMRH, which is the African Medical Regulations Harmonization Initiative, and the United Nations play in strengthening the NDRAs, which is the National Drug Regulatory Authority, to make sure that public institutions are accountable to getting the data necessary to drive efficient and resilient supply chains.
Yeah, so that's a good question. And I might take the opportunity to expand that a little bit to talk about maybe managing information and managing processes a little bit more broadly. I think, as you know, the one of the first responsibilities of a NDRA is market authorization or approval for a product to enter the market. And I think that is a constraint that uh, makes it difficult for suppliers to enter the market and provides disincentives for suppliers to enter the market. So streamlining that process and harmonizing it, which is really what AMRH and the African Medicines Agency are working on now, is just critical. And so while that's not directly related to a flow of information, it is related to an approval process and to streamlining the amount of time and energy and information that suppliers have to provide. Um, and another sort of take on information management that the regulatory agencies are responsible for is, so you have a product that's registered, then you have to apply for an import permit, then you have to wait for the approval, and then when the shipment is ready, you have to get clearance for that shipment. So that process is often long and complex and introduces a lot of both variability and wait time into the supply chain. And what you see now in several countries is that customs agencies and national drug regulatory authorities are starting to work together to build, for lack of a better term, what we call single window digital systems that allow importers to register their products for market use in a country, to request a permit for importing them, to have it granted electronically, and then for them to be able to provide shipping notices that get approved and that can expedite the customs process. So this is really, I would say, in terms of a nuts and bolts data and digitization implementation that is going to speed up the supply chain, really one of the most important areas of work, I think, now.
Yeah.
And then perhaps to get to your question about information management, one of the things that we see increasingly and that countries are focusing on now is how do you manage master data for supplies and, in fact, for many other things in a country. But let's just focus on supplies. And that master data is critical if you're going to adopt data standards like GS1, where you're asking suppliers to be able to use common nomenclature to identify their supplies, so that you can identify them and record them when they come into country, and so that you can ultimately figure
Yeah.
out how you collect and share information further down the supply chain or across supply chain functions and partners. But master data management is something that requires a large, I would say, a fairly significant level of effort. And I don't think the NDRAs, who would be the logical place for managing product data,
Yeah,
just as they're the logical place to manage registration and market authorization data, have the capabilities to perform that function yet. So as we increasingly try to focus on standardization and the use of data and managing those data and track and trace, I think support to NDRAs to perform that function is going to be critical.
definitely. And we are, as you started the interview, you said, of course, we are major focus is now placed in the last mile, and that is, I'm assuming that is from the country down to the health facilities and pharmacies. But I think still there is work to be done at the top part of the supply chain as well. We are still, I think, of course, the COVID is an exception, but still countries are facing trouble in terms of getting and properly quantifying their needs for the country's demand. So, do you think we should first perfect that system before going to the last mile, or simultaneously improve both?
So I think in order to be able to, so I guess the short answer is you need to work on both. In order to be able to quantify and plan, you need good demand data. You can't get good demand data if you're not really recording what's happening at the last mile. Um, in the supply chain world, there is a phenomenon called the bullwhip effect, where demand changes are multiplied as you move up through the supply chain. Lack of visibility into what's happening really at the customer level. And so that is one of the things we're trying to avoid, and one of the big reasons you need to be able to collect data at the point of consumption or the point of issuance to a patient. So I think you need to focus on kind of digitization and data collection at the last mile, in addition to working to help planners make sure they have the capacity and the tools to adequately forecast and plan for their supplies.
So still speaking along the lines of the last mile, how can standards like the GS1 that you just mentioned track and trace health commodities and capture that data accurately at the national level? And the second part to that question is, what are the barriers to be able to do that?
Yeah, that's a great question. So data standards like GS1 are really great enablers of data integration across supply chains and implementing partners, and they really provide an opportunity to streamline the way information and products flow, because people have a common nomenclature that they're using. However, they are really only one part of the process. As I alluded to before, there needs to be an entity at the national level that's responsible for the management of those data,
Yeah,
so that there is interoperability among systems and among partners. And there needs to be tools and processes for capturing, sharing, and updating those data among authorized users, and then a facility to capture the transactional data based on those master data. So you do see this work being done in a number of countries, where they're building what have been termed infomediaries that are designed to consolidate data across various functions and partners and harmonize master data that are used across entities. And then the single window example I mentioned previously is another example where they're trying to harmonize this collection and use of master data. And often in that particular instance, it's associating GS1 data with that. So GS1 standards are kind of one part of facilitating harmonization and interoperability, but you need to make sure you have the people and processes and tools in place to take advantage of it. And so it's by itself, it's perhaps a necessary but not sufficient condition to promote interoperability. Hope that answers that question.
Yeah. And speaking of countries and bright spots, in sub-Saharan Africa, countries like Ghana, Kenya, and Tanzania have improved their supply chains by leveraging strong public-private partnerships with local supply chain entrepreneurs. So, how do you think countries can find, foster, and partner with local entrepreneurial talents to sustainably strengthen supply chains?
Yeah, that's a great question. I think what we see is the pool of entrepreneurs is growing, which is really encouraging. So there's some great innovators out there that are doing interesting work. And then, of course, there are existing suppliers, distributors, and service providers in the private sector who can and do support national public health supply chains. I think the first step is really for national authorities to have a willingness and commitment to leverage local private sector actors and to publicize that commitment and a plan for implementing it. Without that, really, it's hard for innovators, entrepreneurs, the private sector to know how to engage and what the public sector is interested in and what mechanisms they're going to use. And the second is to establish some kind of mechanism for routine engagement of private sector actors that provides a forum for discussion, sharing of opportunities and plans, exchanging lessons learned and challenges, so that there's an opportunity for learning and exchange. And then the third, which is something that's been mentioned a lot previously, is the ability to contract effectively for supplies and services so expectations and accountability are clear and payment is made as promised. I think one of the reasons historically the private sector hasn't been much interested is that they often don't get paid on time. So that's a bit of a problem. So I think those things would help national governments really incentivize local entrepreneurs to participate and provide a forum and mechanism for doing so. As long as opportunities are ad hoc and the desire for engagement's unclear and contracting mechanisms are difficult, the incentive for private sector participation is pretty low.
And also there are lots of regulations in terms of even starting a business in these countries. It's not quite easy to get a business started. I want to go back to that entity that you spoke about, Edward, in the national level to improve data visibility and use within health supply chain management. But should that entity be sitting in the Ministry of Health or Ministry of Commerce? And because if you look at data, it has to, supply chain data has to do a little bit about healthcare, but a lot of thing has to be driven by the commerce department, because after all, we need to make sure that there is proper not only contracts but also money flowing in, so that the supply chain is efficient. And for let's say a country comes up with the data and the data shows that they need X amount to procure this XY medicines, then the other entities must also be pulled. So probably this should be like a national task force that is sustainable.
Yeah, and I think, as you allude to, I think these issues are cross-cutting and they cut across multiple government agencies and functional areas. And so you're right, there needs to be either a task force or a steering committee or something which owns a plan for moving this forward. And you do see that in a couple of the countries that I mentioned where they're building infomediaries, is you do have, it's perhaps led by the government IT department because it sort of looks like a technology activity, but there are stakeholders from the various ministries that are engaged in a formal part of the governance team or the governance committee that drive it forward and provide commitments to achieving certain activities within that overall plan. So that's the way I've seen it done in a couple of places. The IT ministry owns it, but there is participation and commitment on behalf of other ministries as well to make sure that it gets done. But that is one of to be successful, it's got to be, I'll use the term multi-sectoral, multi-agency, and that's of course what also makes it challenging.
Definitely.
And then figuring out on the planning side. So one thing is kind of setting it up, and the second thing is the actual execution and operation and how the program agencies communicate with the regulatory agencies and the budget agencies so that everybody is harmonized in terms of what's needed and what the planning looks like to effectively execute their obligations.
Absolutely. And also, I believe there should be harmonization between the HIS and the LMIS. So there is improvements being made in the health information system side as well. And there are gaps there as well. And even when we look at the programs that are in a lot of low and middle income countries that are funded by donors, international donors, they are usually vertical programs that work in silos. And what uh, that creates a huge gap when it comes to um, accurately getting the data that you need. How do we rather address to ensure that that is integrated as well?
Yeah, no, I think that is a problem. You do see that often funding is by program, but some of the critical systems like supply chains really don't operate efficiently or effectively by program. So I think there it really requires that the national governments provide and take control of that and have a vision for how they are going to oversee their public health supply chains and get donors to participate and use the resources that are available to strengthen public health supply chains overall. I think you can always make the link, or you should be able to make the link between investments that are going into a supply chain activity and the results that a particular program are going to see. And not all products are treated the same because they have different characteristics, they have different sources of supply. So if
Yeah,
you have an overarching body, or if you have an overarching plan or owner of the supply chain, that doesn't mean that all products get treated the same in that supply chain. And in fact,
yeah,
you have to segment them based on their characteristics. So I think recognizing the need for a common governance and strategy, but paying particular attention to individual program needs, those are not, they shouldn't be at odds with each other, and then getting governments to support that and donors to support that with their commitments that may be program specific is important. And I think we see that increasingly now, especially in the face of COVID,
yeah.
that people recognize the importance of really thinking about supply chains as integrated supply chains. And that's, I mean, it's been moving in that direction for a number of years, but I think this is providing even more impetus to that.
Sure. And in terms of like even OCHA, just like doing humanitarian crisis, the Office of the Coordinating Humanitarian Activities within the UN, they work on integrating the humanitarian response. So similarly, in the development as well, the national MOH must have that kind of activity so that they have visibility over not only just supply chain alone as well, but how it kind of or like goes hand in hand with other initiatives as well, and who are the different players in the country that are improving multiple avenues.
Right. And many countries have supply chain master plans where they're really trying to harmonize their kind of 5-year approach to this, which brings together multiple donors and actors. And I think increasingly you're starting to see coordinating bodies which are looking across public and private and trying to understand who can contribute in which ways and who is reaching which customers. That's often been done more on a programmatic basis, but I think you need two levels of coordination and collaboration. One is within government, it's sort of setting the national vision for what the supply chains are, the services that the government's going to deliver, how they get delivered, and what the supply chain should look like. And then a kind of overall stewardship platform, which says, okay, how do we bring together public, private, and nonprofit organizations and actors in order to be able to meet the nation's public health needs and think about what role each of them can play. And if you can begin to establish some of those lanes, then again, it makes it easier for everybody to participate.
Thank you for those responses, Edward. I would like to take you back to the conversation we had about governance, integrated supply chains, and point out that the global pandemic we're currently experiencing exposed the fault lines in supply chain management systems. And some countries did better than others. And we can go back to how their health systems are structured, whether it's a single payer system, it's a centralized or decentralized system. So, from your experience or in your experience, what health system would propagate that interoperable supply chain system?
Yeah, so I think obviously one where there is a central body that has oversight and control over what's happening makes it easier to manage and coordinate a response. I think we've seen with systems that are highly decentralized, where the central level and the intermediate levels are sort of loosely connected to each other, it can make it very difficult because you don't have great visibility, and then the planning and response can be challenging. So I think that you need some level of central level control and um, authority in order for the supply chain to be responsive. Doesn't mean that at a decentralized level you can't take responsibility and adjust, but I think some agreements about what the functional processes are, what the data requirements are, and how the functions are going to work and what the division of labor is important. But without some agreement about how things are going to move from top to bottom and some ownership and visibility and control over that to make sure that it's happening, it makes it very difficult. Things tend to fall apart in a hurry, especially when the supply chain gets stressed. And so I think that's the first thing. There needs to be some central level point of control, or at least oversight and management for it to be successful. And then two, obviously, supply chains can only work when things come into the supply chain. And so I think we've seen recently that with the global supply shortages and supply chain breakdowns, even if you had a relatively well-performing, so incapable supply chain in country, the fact that you couldn't get stuff into the country because suppliers were locked down, because global distribution networks weren't working effectively, that I think is something else that everybody is reflecting on now and is one of the outcomes of the pandemic, is how do you build more resilient supply chains, both at the top end in terms of the way you source products and where they come from, and then within country as well in terms of how you make sure that the systems and processes and people that you've got are able to withstand shocks better.
And speaking of people and systems, moving on to the human resources for health for supply chain, People That Deliver recently launched their supply chain professionalization framework, which helps establish a set of global standards that align career path, education, and professional growth in health supply chain management. How do you think countries can not only increase their cadre of supply chain data analysts, but also coders, data engineers, and AI experts in a bid to advance their supply chain systems?
Yeah, that's a great question. So I think, what you need is both supply and demand to create a strong and vibrant labor pool, and that's true for supply chain and what I'll call data science professionals. And to grow the local pool of experts, there needs to be a demand for those experts. And my sense is that while there is some demand, the market is still nascent in many places, and individuals with those skills migrate to other fields. On top of that, hiring data science staff in particular makes sense when you get to a certain scale, level of digitization, and level of data use. As we were talked about before, we don't often or don't always get high quality point of sale, point of demand data. And so the amount of data that's available and the quality of those data are not always very high. So I think the market reflects the fact that supply chains are still fragmented and not yet as digitized as we would like them to be, and that in the public sector in particular, the central bodies responsible for supply chain management are not always well staffed. So to increase demand for those kinds of staffs, we need to continue our supply chain digitization and integration efforts. We need to continue to emphasize the use of data for planning and management purposes, as we were just talking about. And we need to continue to advocate for professionalization of supply chain functions. At the same time, I would hope that public and private educational institutions would continue to develop and refine their curricula to produce experts that can meet market demands, and that local, regional, and global funders will fund innovators as they apply data science techniques using locally available data so they can demonstrate how data science can be used to solve local and regional problems. So I think there's not a simple solution, and you have to work on both the demand and the supply side in order to really increase the pool of people that are actively involved in managing supply chain systems. I hope that helps.
It does a lot, and I think going on a personal level, how did you get interested in health supply chain management in low and middle income countries, and what has been your professional journey and experience so far?
Yeah, that's a good question. So just in terms of how I got interested in supply chain management, I sort of got into that via computers and digital systems. When I was in college, I worked with statistical packages, and after a while, I became a computer programmer working on supply chain applications. And then I got more interested in supply chain management more broadly and stayed in that field even after leaving my role as a computer programmer. Um, and then in terms of working in public health settings in Africa, I got interested in that by first, when I was a child, I was fortunate enough to live in East Africa for a while. And then when I was a bit older, I worked in Central Africa as a Peace Corps volunteer. And then after my Peace Corps career, I was lucky enough to find a job in global public health. And so I've always been interested in the particular challenges that are faced in trying to solve public health problems uh, in Africa in particular. And I've always been amazed by the creativity and resilience of the people that I've worked with and their ability to find solutions using the information and resources that they have available to them. So that's kind of a quick overview of how I got into this.
That is very interesting. And reflecting back on your professional journey, Edward, and the current state of supply chain management, what are some professional skills that every health commodity supply chain manager must develop, whether it is in the data analytics space or project management space? And we definitely see a lot of certificates and courses that's being advertised globally. But given the trend, what are some promising skills we must improve on?
Yeah, so I'll just talk about kind of general capabilities. And some of them are technical, but some of them are not. So, I mean, the first thing I think for anybody to be successful is really to be able to build trusting and productive working relationships with your clients and with your colleagues. If you don't have people skills, then it's hard to be successful no matter how technically strong you are. You really need the ability to conceptualize and manage an activity successfully from start to finish. So you need kind of basic project management skills along with some imagination and technical understanding. So you really need a basic set of management skills, I would say. You need the ability to present yourself, your work, and your organization in a positive and professional way. Without that, then it's difficult to be successful and effective and to grow. You need a broad understanding of the discipline of supply chain management, but then a deep understanding of some aspect of it that allows you to add value to your team and to your organization. And many of the certification programs give you often that broad understanding. And then obviously, if you pursue a specialized course of study or certificate, you can frequently get that deep specialized skill. And then the ability to understand and analyze a problem or issue so you can identify what it is and its causes, possible solutions and priorities, and what the results are going to be from those solutions. So you really need analytical skills as well. So I think that successful supply chain professionals need a combination of people, management, presentation, technical, and analytical skills to be successful.
Definitely. And you have a solid, history of managing large teams. What are some leadership and management principles that have helped you along the way? And what is your leadership advice to young managers?
Yeah, well, that's right. So I'll mention a few things and happy to answer any questions too. So one, I think it's important to understand what you're trying to accomplish and articulate your objectives clearly so people know what they are. I think everybody in the team or in the organization and their projects wants to know what success looks like. So being able to set that vision is important. Then I think you need to be able to establish the mechanisms and strategies for getting there so that people can align their work, their individual work, their team's work to the project's or organization strategies and understand how they fit in. Personally, I think it's important to empower managers and staff to do their work, make sure they have the tools to do so, and then hold them accountable for getting it done. I've tried to avoid micromanaging over the years and to give people freedom to pursue their work how they want, as long as it fits into the larger organizational context and requirements.
Sure.
Build mechanisms for collaboration, communication, and cooperation across teams to avoid silos and finger pointing. I think this is really critical, as it's easy for teams to get focused on their specific deliverables and forget the larger customer service objective or organizational goal. I think it's really important to regularly check in with staff to see how they're doing and if they need support. There's no shame in asking for help, and I'd prefer people ask for help rather than letting tasks slip and finding out that something's gone wrong later on. I think you need to be talking to staff at every level of the organization informally to be sure you're not missing something important that's happening in the organization. It's easy as a manager to get disconnected from the day-to-day work if you don't check in with a cross-section of staff on a regular basis. And then I've always tried to be a buffer between the client or the board and the staff. So the staff can focus on doing their tasks and their work, and I can focus on trying to translate that to the client or the board as needed, and to identify if there are areas that need improvement or challenges that come up, translate that into some productive set of activities we can do to address them. Make sure you give credit freely and publicly. I think it's really important to praise people often and praise them publicly to build up their confidence and their sense of well-being. And then report on progress regularly so that everybody knows how you're doing as an organization.
Absolutely. Those are spot on and really quite inspiring to professionals in raising professionals in public health and supply chain management. And along the lines, so what are some promising trends that you see in humanitarian and development supply chain fields, and how it will be changing in the near future?
Yeah, well, I think I think in terms of promising trends, I think supply chain has become much more top of mind for policymakers, planners, and managers than it was before. So what I would expect there to be continued interest and investment in this field over the next 5 to 10 years, at least. I think that COVID has made clear that if you don't pay attention to supplies and supply chains, that you can be in real trouble in a hurry. So that's kind of the silver lining to the current pandemic. But I think resilience and resilient supply chains are going to drive investment and planning, at least over the next 5 years. There will be an increased interest in and focus on sourcing and industrial policy, as I talked about a little bit before. Where are my supplies coming from? How do I understand supply risk and mitigate it? What products should I try to produce locally or regionally for health or national security reasons? And you see that in the United States. There was a supply chain assessment done by the president.
Yeah.
There's going to be an increased focus on supply chain and network analysis and design for the same reasons. Where should I source from? How should I deliver? What are my risks? How do I mitigate those through design and operational procedures? I think there's going to be an increased emphasis on private sector partnering and engagement to mitigate risk and improve efficiency and provide greater choice to consumers.
Yeah.
I think there's going to be, as we were talking about before, an increased focus on integration of product categories into supply chains that serve similar customers. We still have supply chains in some cases, as you mentioned, that are vertical for HIV, malaria, TB, or essential medicines.
Yes.
And as I said, while the products for those programs don't all need to be managed in the same way, they need to be overseen and managed as part of one supply chain. I think the distinction between humanitarian response and development will continue to diminish. Routine supply chains need to plan for epidemics or disasters in humanitarian response, and humanitarian response responses need to integrate with and reinforce existing supply chains and supply chain actors as much as possible. And then, as you've sort of intimated with the topic of this conversation, the future is digital, and our supply chains will increasingly digitize to the consumer level, and we need to promote and take advantage of this. And then I think there's a kind of overarching trend and realization that we need to move towards supply chain and trade harmonization, which can contribute to a faster and smoother flow of goods and services. We need to be looking at our supply chains from source of supply all the way to end consumer, and find out what the enablers and bottlenecks are along the chain, and advocating for change when those occur. So I think the future is bright for supply chain professionals around the world. However, we're going to have to be nimble, forward-looking, and creative to be successful.
Sure.
Well, thank you for that that summary, because you've captured it nicely. And I think that was the word I kept thinking about when we talked about supply chains, and the future is being nimble. And again, the pandemic really exposed those fault lines, that then in order to adapt, we have to make sure that not only are we being resilient, but that we're really being nimble. One last question before we wrap up. What has been your most memorable experience so far in your career?
Oh, most memorable experience. Wow. So that's a good question. I would say being at a, this is early on really, but being at a local clinic and really seeing what difference can be made by making sure products are available, as you see a long line of people that are waiting for services with their children, and that the supplies were there, they could get services, and they and their children could be healthier. So I think that experience early on really reinforced the importance to me of public health in general, and supplies and supply chain in particular.
Yeah, that definitely. Thank you for sharing that experience. First of all, Paul Farmer had defined this framework for health systems, where he talks about the 4S. It has been expanded to the 5S's now, which is essentially space, staff, stuff, and systems. Like, any health system has to be comprised of those four. And like you rightly said, in that clinic, long waiting lines. If only people can get the stuff within the system in a timely manner, then we would improve the health outcomes. So once again, thank you for sharing that experience. As we begin to wrap up now, we really want to thank you for your time and expertise. Sharing, we've definitely learned a lot from your experience, as we've talked about, implementing sustainable and interoperable global health supply chain systems. We particularly like how you mentioned how health systems, whether they're centralized or decentralized, really need to take that multi-sectoral approach to addressing supply chain needs. And I think, like you alluded to, the future of supply chain is digital. And as we work to increase the task force, both from a demand and supply side, we have to think about that digitization and how we're training and equipping systems and the people that would respond to that. And I think, lastly, like you said, we have to think of resilient, nimble, and adaptable supply chains in order to address the growing health needs. And I think one thing that we probably didn't touch on, that it wasn't necessarily the focus of this, was the impact of climate change on resilient and nimble supply chains. And I think that's definitely something that will be food for thought as we wrap up today. So once again, we want to thank our audience for their time and patience. Please subscribe to our channel, follow Dr. Edward Wilson in his work. Actually, on that note, if any of our audiences or anyone who is watching this after the fact would like to reach out to you, Edward, what are your social media handles?
Yeah, that's a good question. So you can get me. I'm not much of a LinkedIn person, or not much of a Twitter person, that's for sure. But you can get me if you just search for Edward Wilson, you should be able to find me on LinkedIn. And here's my LinkedIn handle. If you want to publicize it, that's fine. If anybody wants to connect with me, I would be happy to respond.
Thank you, Edward. And once again, thank you for your time and expertise. We look forward to having you on the channel another time. And to our audience, please feel free to reach out to Edward for questions on supply chain. Please, in the meantime, stay safe, be well, and hope to see you next time.
Great. Thank you for the opportunity. Have a good day, everybody. Take care.
Thank you very much.